Well, good afternoon, everybody, and thank you for being here today. I know it is a busy day for all of you. Joining me as usual are Dr. Michael Apostolakos, Chief Medical Officer for UR Medicine, and Dr. Robert Mayo, Chief Medical Officer for Rochester Regional Health. As you know, earlier this month, Rochester Regional Health announced that several patients have tested positive for COVID-19 strain mutations in January and February. UR Medicine has also been sending samples to New York State's Wadsworth Laboratory, which is testing for the presence of COVID-19 variants in the state. The latest results returned to URMC show that indeed, the UK variant has been found in 2 cases in Monroe County. The UK variant cases were identified in patients who tested positive for COVID-19 in February and came from a sample size of 489 patients. A small handful of the California variant has also been detected in the region. The good news is, despite the confirmed presence of these variants, we are not seeing a corresponding surge in positive cases in our community. These samples were drawn in December, January, and February, so the variants have been out there. But as you know, over the past 3 months, our positivity rate has dropped significantly and is currently now holding steady. Our hospitalization and ICU rates are also greatly improved. So what does this change? For the average Monroe County resident, nothing. It simply underscores the importance of everything we have been saying and doing to control community spread of COVID-19. The variants, though known to spread much more quickly than the initial disease in many places, have not done so here. And it's no secret as to why that has not occurred. Masking, physical distancing, staying home when we are sick, observing all guidance related to gatherings and travel, working carefully with our contact tracers, and now getting vaccinated. Today, the opportunity exists for everyone 50 years and older to be vaccinated, either at a county clinic or one of the many other locations opening up throughout our community. The list of eligible essential workers recently expanded, and now many of us are eligible due to existing comorbidities and underlying health conditions. If you have been waiting to get your vaccine, wait no more if it is available to you. Even though we continue to learn more about how protective the vaccines are against these variants, the research shows that they are effective and certainly more effective than not getting the vaccine at all. We are seeing more and more vaccine coming our way. The supply is coming closer to meeting demand. And so if we want to continue keeping these variants at bay, keeping our positivity rates low, and marching toward a greater degree of normalcy in our lives is very important. And vaccination is an important step in that direction. So in closing, I just want to remind everybody, we actually have a lot of open appointments at the convention center this week for vaccination. So I want to encourage everybody who's watching, spread the word, go to monroecounty.gov to sign up. And with that, my colleagues and I will take your questions.
Thank you, Dr. Mendoza. Our first question today comes from Jack West with Spectrum News. Maybe Jack's not on, so we're going to move on to James Brown, WXXI. James, you're on mute.
Sorry about that. The California variant, in terms of contagious nature, does it match the UK? Is it less so? Is it more so? I haven't heard much about it in the discourse.
I'm going to ask one of my colleagues to see if they can field that question. I don't have the details on the differences between the California and the UK variant. It's relatively one of the newer ones, but I don't have any details on that. Mike, I think you're muted.
Yeah, we can't hear you, Dr. Apostolakos.
I'm sorry.
Nope, go back.
Can you hear me now?
Yes.
I'm sorry. Yeah, the data on the California variant isn't as well known as the UK variant, which is more infectious and has a increased mortality rate. I have not seen that data for the California variant. Most of the variants are more infectious, but I think the jury's still out on the severity of illness it causes.
there will be a selection bias for variants that are more infectious and more serious, because those are the ones that will cause an outbreak or a hotspot that will be tested more with more scrutiny. And so we may not know if there are more benign variants, but that is a matter of fact related to the evaluation process.
Right, and all of the variants that we're talking about, all the variants that anybody will talk about are by definition going to be a variants of concern. As Dr. Mayo mentioned, a variant that's less virulent will not be of any concern because it won't end up predominating in our community. So any of the variants that we talk about will by definition be either more contagious or may cause more severe disease.
James, do you have a follow-up?
No, I'm good.
Okay, we're going to move on to Dan Gross from WROC.
The AstraZeneca vaccine is about 80% effective in preventing infection, but it's like the other vaccines, 100% effective in preventing severe illness, admission to the hospital, or death. So it's highly effective. There was some initial concern that it may have more serious side effects, but the data suggests that that's not the case. So once again, when that's available, like the other 3 vaccines that we currently have available, I would encourage the public to get vaccinated with the first vaccine that becomes available to them, because they're all effective in preventing serious illness and death.
You have a follow-up, Jack? Thank you. Patty Singer from Minority Reporter, you're up next.
Hi, thank you. Have there been any reports in the county of people who have been vaccinated and then developing COVID?
So we're looking into this. There have been examples of people who had just gotten their vaccine and then within either the first or the second and have tested positive within a week or two. But we are looking into that. We keep hearing reports, and we're not declaring anybody a vaccine quote failure. But this is something we always look into. We always get all of the reports, and we want to hear about the reports. The FDA is also tracking this as well through their Be Safe app, which we encourage everybody who gets the vaccine to participate in. So we're certainly monitoring all of this, but we have no evidence at this time to declare anybody a quote a vaccination failure, if you will.
As a follow-up with the variants, will there be a period of time, sort of like an incubation period, where then we may see in a week or two that there is a spike from variants? Would it work that way?
Well, it would work very similarly to the wild type, the initial strain. So any change that you might detect on day 0, you wouldn't necessarily see until another week or so. So the incubation period from the original coronavirus strain, COVID-19 virus strain, would be the same as far as we know for any subsequent of these variants.
And in follow-up, Patty, that's what's very reassuring about right now. We're not seeing a spike in cases. We're not seeing a spike in hospitalizations or ICU admissions. There continues to be a slow decrease in hospital admissions.
Thank you.
Thank you, Patty. I'm not sure if we have a reporter on from 13 WAM.
Yes, hi, can you hear me?
Yes, we can.
Okay, so I wanted to ask Dr. Mendoza about, for sports, I believe you said that the presence of variants could end them. Does that change anything in regards to high-risk sports?
Not at this time. We continue to profess the importance of masking and distancing as usual in these higher risk sports. But we're going to be looking at the community transmission rates in general. And if that changes to a substantial degree, then we'll revisit this. But, you know, when Rochester Regional Health announced the initial mutations, we took the issue up again, and we decided at the time that we didn't need to make any changes. And I think the news here today doesn't change any of our approach at this time to higher risk sports.
And my follow-up question is still about schools for the 3 feet versus 6 feet. Are you continuing with pushing for 3 feet, or has that anything changed with that, or schools should be cautious with the variant?
Well, as you know, the state health department is who ultimately needs to change the guidance to allow the schools then to be able to adopt the CDC guidelines, which is what I would endorse. But right now, we have not yet heard anything from the state health department in that regard. So all of the superintendents and districts are waiting just as everybody else is to see if there are any changes. But the presence of variants wouldn't change necessarily how we interpret or generalize the CDC guidelines. I think the CDC guidelines were written with the presence of variants in mind, because there are actually many communities around the country who are seeing a much higher prevalence of these variants. And so we are relatively new to the scene, which is fine. But I think the CDC guidelines account for variants.
Thank you.
Thank you. Is there a reporter on with WHEC? Okay, we're going to go to our final questions from Brian Sharp at the Democrat Chronicle.
You just actually jumping off of when you're talking about prevalence, is there any sense, since we saw these show up in December, January, February, and our hospitalization and admissions and such are going down, can you extrapolate from that any sense of how prevalent these variants are in our cases here, or if we're still predominantly the original strain?
At this time, Brian, I think that's a little premature. We've sent over 1,400 samples to the state and have received back 489. Now they're spread and have returned in February, so we know some of those were from February, but we still have almost 2/3 of the samples to return. I think right now, as you state, the best news is that COVID numbers of infections aren't going up. Hospital admissions aren't going up, and ICU admissions aren't going up, which suggests that at least there's not a predominant strain that is causing severe illness at this point.
And for those of you who are interested in extra credit, I've put in the chat there a website that allows you to track the presence of variants across the region, country, and the globe. So there you'll see all of the variants of interest on a global level, and you can dig into a lot more detail than we're able to provide to you here.
And I would add, from a Rochester regional perspective, we've also sent out some hundreds of samples for additional testing, and I do think that data needs aggregation and further analysis.
Thank you. And it's just one other one is, I'm wondering, do we at this point, I don't know if it seems like someone along the way said that we just have to assume that maybe all the variants, majority of the variants are here in some form. I don't know if that's correct, or if there is one that has folks particularly concerned as we're testing for these, because these have shown up and we're not particularly concerned. Is there one that we're wary of?
I think that's the entire point, Brian, that right now, this doesn't change clinically what we do in caring for patients, and it shouldn't change at all what the community has to do. The community is doing a great job of continuing to mask, social distance, keep their hands clean. And if we keep that and get vaccinated, any of the variants we've seen so far have not been able to avoid vaccination. So if we keep doing what we're doing, I think we can worry less about the variants. I think, what is the worry is if we do see a spike in cases in a predominant variant that's more communicable and more serious, we'll see it by numbers going up and hospital admissions going up, and we see no evidence of that at this point.
Another important take-home point here is the faster that we keep vaccinating and people accept the vaccination, then the less likely we'll have concerns about variants. And it's very logical to presume that there will be new variants yet to come. And so the faster we can control the pandemic, the faster there is widespread immunity, then the less opportunity the virus has to morph into another variant. So that's an important point that I think really is motivating for us as a community to think that we could actually have that kind of a positive impact on the virus for further protection.
Thank you.
Okay, thank you. That does it. Thank you all for joining us this afternoon.
Thanks all. Have a good day.
Thank you.